Diabetes. 38 million Americans are living with it. That's more than the entire population of Texas. Another 96 million adults have prediabetes. It's the leading cause of kidney failure, leading cause of blindness in adults, a major driver of heart disease and stroke. And yet, most people think diabetes is just about eating too much sugar. It's not. Today, we're talking about type 2 diabetes, what it actually is, how it develops, and why understanding it changes everything. I can't wait to get into this episode. Welcome to Fuller Living, your space for empowerment, inspiration, and practical health nuggets. Here you'll find relatable guidance that fits your everyday life as you journey to a fuller and healthier you. I'm your host, Dr. Ashitey. Let's dig in. Hello. Welcome back to another episode of Fuller Living. Wherever you are, whatever you're doing, as always, I am so glad that you've chosen to spend your next few minutes with me. I'm also very excited about today's topic, diabetes. A few years ago, I had a patient who had an emergency situation that we needed to manage in the clinic. We stabilized her, we called the EMS personnel to come take her to the hospital. And as is customary, they asked her questions about what her medical conditions were. And one of the things she mentioned to them was prediabetes. And guess what happened? The EMS personnel laughed out loud. One of them said, "That's not a big deal. We all have that." And I remember standing there in that moment, fuming inside, but very professional on the outside, thinking, no, we don't. That wasn't the moment, however, to have a lecture. We had a patient to care for, but that moment really stayed with me because prediabetes is not benign. It's not a joke. It's not something we all have. It's an early sign. And today, we're going to talk about why. Really, what is diabetes? I'm so glad you asked. Diabetes is a condition where the body can no longer regulate blood sugar effectively. And to understand that, we have to understand what normally happens in the body when you eat. Let's for a moment play pretend and sit down and eat a meal. I invite you to follow the food from first bite down the GI tract into the bloodstream to understand what really happens. So when you take your first bite, you chew, it's amazing. You swallow, and your body immediately gets to breaking that food into its basic components. Carbohydrates are broken down into glucose, which is sugar. Glucose is not bad. It's not the enemy. It's your body's primary source of energy. That glucose gets absorbed from your gut into your bloodstream. Now you have sugar circulating around in your blood. But your body doesn't want that sugar just floating around aimlessly. It needs to get that sugar, that glucose, into cells, your muscles, your liver, your brain, where it can use that energy for later. And this is where insulin comes in. Insulin is a hormone made by your pancreas. Think of insulin as the key. Its job is to unlock the doors of your cells so that glucose can move in safely from the bloodstream into the cell. Now, when insulin works well, blood sugar will rise appropriately after a meal, but then it's going to come back down. So glucose is either used immediately or it's stored for later. Some of it is stored in your muscle, some of it's stored in the liver as glycogen. And if there's more than your body needs, some of it can be stored as fat. This is normal physiology. That's how the system is designed to work. It's amazing. And personally, that's why I believe in intelligent design, because wow. Now, diabetes happens when that system breaks down. Either the body doesn't make insulin or it makes insulin, but the cells are not responding properly. In type 1 diabetes, the body stops producing insulin altogether. It's an autoimmune condition. The pancreas can't make the key. But in type 2 diabetes, which is far more common, the body is still making insulin, but the cells have become resistant to it. The key is there, but the lock has become stiff. The door doesn't open easily, so the pancreas makes more insulin and more, trying to force the door open. For a while, that works. Blood sugar stays normal because insulin levels are rising behind the scenes, but eventually the system becomes overwhelmed. Blood sugar starts to rise. That's when we begin to see prediabetes. And if the process continues, it can progress eventually to type 2 diabetes. So, how does that happen? How does that lock that once opened so easily become stiff? Insulin resistance develops gradually. It's not something that happens overnight. When we consistently take more energy than our body can use or store efficiently, the storage system becomes overloaded. Muscles become less responsive. Liver begins producing more glucose than it should. Our fat cells, especially the visceral fat around the abdomen, become metabolically active and release inflammatory signals. The inflammation interferes with how insulin signals the cell. And the key is still there, but the lock is sticky. Muscle is one of the largest users of glucose in the body. When we move regularly, our muscles become more sensitive to insulin. When we're sedentary or sitting down all the time, that sensitivity decreases. The lock, it becomes harder to turn. Chronic stress, for instance, as well, increases cortisol. Poor sleep starts to alter your glucose regulation. And over time, these hormonal shifts can make the cells less responsive to insulin. When the cells stop responding well, the pancreas senses the rising of your blood sugar, and it does what it's designed to do. It starts to produce more insulin. But for years, insulin levels may be high even before sugar rises, and that stage is often just called insulin resistance. And when blood sugar begins to rise but hasn't reached diabetes level yet, we call that prediabetes. If the process continues long enough, the pancreas can no longer keep up. Blood sugar starts to rise consistently, and now we have type 2 diabetes. And this is why prediabetes is not something to laugh about. It's not a joke. It's not something we all have. It's an early warning sign. It's the body telling you that the system is under strain, but it's still compensating. And here's the part that really matters. This stage is often modifiable. Insulin resistance can improve. Cells become more responsive again. The pancreas doesn't have to keep overworking forever. That trajectory can change. Prediabetes is not a sentence, it's just a signal. So, what actually changes when we intervene? Let's go back to that lock and key system. Imagine someone who's been mostly sedentary. After meals, their blood sugar rises, insulin rises. The pancreas is working really hard to push that glucose into the muscles that haven't been or aren't as responsive. Now, imagine that same person starts taking a 10-minute walk after dinner. Simple walking, nothing fancy. When the muscles contract, they start to pull that glucose out of the bloodstream, even without needing much more insulin. It's like opening the door from the inside. Blood sugar comes down more efficiently, the pancreas doesn't have to work as hard, and over time, these muscles become more sensitive again. Now, imagine someone gradually loses a small amount of that visceral fat, the one that we talked about that increases that inflammation. That fat isn't just storage, it's metabolically active, it's releasing inflammatory signals. So as it decreases, that inflammation decreases. And when inflammation decreases, your insulin signaling improves. The lock becomes less sticky. Now, let's take sleep, for instance. For someone consistently sleeping 5 hours a night or less, cortisol levels stay elevated, glucose regulation becomes impaired. Now, imagine that you start sleeping more. Your hormone balance improves, and now your insulin is working better. Morning glucose are going to start to stabilize. And this is why early intervention really matters. Because the pre-diabetes stage, in that stage, it's strained, but it's still flexible. We're not rebuilding a burned down house. We're just adjusting the pressure in a system so that it can respond appropriately. There is something that we can do in this stage, and it's very important to know it and act now. Understanding all of that is powerful, but understanding without action doesn't really change anything. So let's start setting our SMART goal for the week. Remember, a SMART goal is one that is specific, it's measurable, achievable, relevant, and time bound. This week's SMART goal is focused on improving our insulin sensitivity in real time. We're going to use movement. Specific. After one meal per day, you're going to move your body for 10 minutes. Measurable. Let's track it. Check it off in your notes app, put it on your calendar. Tell someone you're doing it. Just 7 days, 7 check marks, and that's it. Achievable. This isn't a full workout plan. It's not 45 minutes in the gym. It's 10 minutes and that's it. You can walk, you can clean your kitchen, you can take the stairs, you can pace. One of the things that I do in my clinic is after I eat my lunch, I walk around in the clinic. I could be on a meeting talking with someone and I just pace around, okay? Relevant, because your muscles are going to contract. They're going to pull blood sugar from the bloodstream. You're going to lower your post-meal blood sugars in real time. And this is going to help insulin do its job, which in turn helps you either reverse or prevent prediabetes or even diabetes. Time bound. You're going to do this for the next 7 days. Everyone can do that, right? Small, consistent actions is what is going to shift your physiology. This is how prevention works. It works quietly, it works gradually, and you've got to be intentional about it. So today we talked about diabetes. We talked about how the system is designed to regulate your energy, how insulin does its job, and what happens when the locks become resistant. We also walked through what normally happens when you eat. We followed glucose from your plate all the way down to your bloodstream, and we watched insulin unlock the door to your cells. And we saw how over time that system can become strained. But most importantly, we talked about the window, the stage where the system is still flexible, that insulin resistance and pre-diabetes phase that we can actually improve, where direction still matters more than perfection. Prediabetes is not something that we all have. I want to make that clear. It is not this inevitable thing that happens at some point. It's not a moral failure either. That's very important to note. It's just a signal. And when you understand the signal, you can change the trajectory of your life. If this episode today changed the way that you think about diabetes, even if it was just a little bit, I want to hear from you. What part surprised you the most? Was it the insulin resistance part? Was it the compensation phase? Was it the fact that your muscles can actually lower your blood sugar in real time? Send me a message. Share this episode with someone that you love, and make sure that you subscribe to this podcast so you don't miss the next part of this cardiometabolic series. Next time, I am talking about high cholesterol. You do not want to miss it. So, until next time, let's get to fuller living. Well, fam, that wraps up another episode of Fuller Living, where we talk about health in a bite-sized, relatable, practical, and fun way. Remember, it's not about being perfect. It's about making progress one small step at a time while remaining consistent. If you found this episode helpful, please subscribe, share it with a friend who might need a little bit of inspiration, and leave me your 5-star review. And if you're in Dallas and looking for a new PCP, look me up at southwestfamilymed.com. I can't wait to meet you. Until next time, let's get to fuller living.